The Unconventional Therapist's Guide to Nothing.
Hey, everybody. Welcome to The Unconventional Therapist. My name is Dave, and I'm joined here with my co-host, Greg. And today is a special day. It's Martin Luther King Day as we record, which
yes, it
is a day we all love to honor and commemorate a man who did a lot for the civil rights movement and just for humankind in general, I like to think.
Also, the cadence of his writing and his speeches, I've always found fascinating. Like letters from Alabama prison or something like that. See, I wasn't expecting you to hit me with Martin Luther King, but I'm actually glad you did it. You want to know why? Because I did my due diligence today. I realized that it's Martin Luther King Day, and I was cognizant, and I thought, I have a bunch of kids.
Yeah.
I should probably do something, and I couldn't really think of what. So you know what I ended up doing?
I'm not sure.
I said we're gonna take a break. Everyone, nobody has any school today. We're gonna watch a movie. And do you know what I threw on?
MLK? No, Selma.
Remember the Titans.
Remember the Titans.
What I mean, honestly, that is one of the most feel-good movies, and you do learn a lot. Like my kids. I live in Cranston, Rhode Island. It's a very diverse community, so they don't really understand racism. Really, it's not really.
Yes, they do. Jack and I talked about it, actually.
Well, Jack's older. He gets it.
We actually talked about it, I believe. We talked about how little diversity there is. I'm almost positive I had that conversation with him on Christmas Eve.
What, Jack in North Kingstown?
Yeah. Oh, maybe that's what it was.
Yeah, my boys in Cranston.
Yep.
They've got it covered. But it was nice because they could see how ridiculous and foolish it is, racism and all that. But we've done the Tulsa race riots.
Yeah, and that's funny you brought that up because I was watching a movie the other night. What is that new Leonardo DiCaprio movie, The Flowers of a Killing Moon or something like that?
Yeah.
And they bring up the Tulsa race massacres within that film because it happens. The setting of that film takes place at the same time as the Tulsa race massacres, and in a way, and I'm going to be completely transparent. I didn't finish the movie. It's 3.5 hours long. Like, who has time for that? So I watched 2.5 hours, and I was like, oh, let me see. It must be almost over. And I was like, there's another hour. I got to go to bed. So
forget it. Yeah,
I still don't know what happened in the last hour, but I have to say, the movie itself feels like a version of the Tulsa race massacres, just with Native American individuals versus African American individuals. Basically, a community of people become wealthy, and then the white infiltrate, and we all know the end of that story. Yeah. So I thought that was a kind of an interesting plot line for that film.
Okay, so what is your recommend? Do you recommend watching half the movie? Do you recommend it?
Yeah, I enjoy it. It's a Scorsese film, I believe. Yeah. So it's like watching, any Scorsese film, like, mafia mob stuff, but within the time frame of, Native Americans, cool. And the 20s, you know what I mean? So it's interesting. I enjoy it, but I'm sure that it's probably not for everybody as well.
So this is the most small talk we've ever done in an episode ever.
Yeah, probably.
And I think it's time we rein it in because people are going to be completely confused what we're having an episode about. And actually not, because there's the title. And we're talking about EMDR today.
You know what, Greg? I was really happy to do this topic for the one reason that we finally can figure out what EMDR stands for.
Yeah.
I don't know if you remember this. There was an episode we did, I think it was the trauma episode, like way back. Yeah. And we were like, eye movement ER doctors.
Yep.
Like, yeah. I don't think we knew what it stood for. So eye movement desensitization. I still don't, apparently.
I can't say it, but
desensitization and reprocessing therapy.
I practice saying desensitization.
Wow.
Desensitization 4 times today, because that's a doozy.
No wonder why they just made it into an abbreviation.
I know. They were like, forget it. Let's do a little acronym here. So, Dave, for me, I'm gonna try to like layman's this before we get into all that stuff, because EMDR it's different than other therapies for trauma.
It just hits different, you
It
know?
hits different, right?
Yeah.
It's relying on your mind to heal itself in a sense, or it's like getting a second chance for your brain to process a trauma with the idea that being under the right conditions, we can get it right. So think about how you,
Craig, for one
yeah,
second. I actually kind of almost see it too as like the whole thought process that goes behind CBT, where we tell people to reframe your thinking and you'll feel better. In a way, with EMDR, there's an aspect to it that's almost like, let's reframe this the way you're thinking about this traumatic experience, and you'll feel differently, and hopefully you'll just feel less worse. Is kind of
yeah. And I think a lot of it is kind of not new. Like it's a very new therapy, but I think that it's borrowing again from everything else.
it's and you know, the more that we dig into things, the more we see. I guess, well, I mean, everything stems from some sort of idea that someone learned, so I guess it's
Right.
not that silly. Yeah, exactly. But I mean, even his things,
Of
you
course.
know, he found from somewhere and then he expands on it. So I guess that's always going to be the case. I think we just kind of chuckle because there's this general sense of someone must have invented this. Like we talk about the inventors of something, but then we actually just discover, well, they just took this basic concept and they expanded it into something
Pretty
else.
much all of it, and like just kind of mix it around a little bit.
Which
But I do
we
like this
shouldn't.
one.
We should be careful though, because we are also starting to do that ourselves. So
Yeah.
like we are not talking trash. We're just kind of
Yeah.
laughing at this idea that someone invented something.
Hey, listen, if you can't beat them, join them. We're trying to get on board with that, right?
Exactly.
But Dave, think about it like this. We do trust our bodies to heal itself. So, if we get a cut, we clean it and we just let it heal. If we break our arm, we reset the arm and we let it heal. Why
We chop our hand off, it just grows right back.
Well, see, that's the thing, right? I mean, maybe sometimes you go too far. But I think the idea is like if you have a trauma, your brain is designed to heal itself. So it's like, let's put it through it this same thing again and see what it can do. Like, let's reprocess this.
Yeah.
So what exactly is this thing? So we're not going to go through the acronym again, but it's a therapy and it's used for PTSD mainly, but they're saying that it's used for a bunch of different conditions, which I'm kind of on the fence about. What do you think about that?
I actually have a list of those conditions. You want me to
Sure, yeah.
quickly go through those? So some of the conditions that they can utilize it on are anxiety, depression, dissociative disorders, eating disorders, gender dysphoria, OCD, personality disorders, and trauma disorders. I don't know why I'm tripping over every word today, so I'm just going to let it roll with it. I'm not editing
that's
any
fine.
of that out.
It's only an audio medium. What's the big deal?
Yeah. So I just listed a bunch of disorders, but I'll be honest with you, I've personally have never heard it used for anything other than trauma.
Yeah, because I don't really understand how it would work on anything else.
The only other thing is like anxiety. I could understand maybe because you might have the person think about, and we're kind of getting ahead of ourselves, think about an experience or moments that give you anxiety and they can work on lessening that. That one, I guess, makes sense. Maybe, well, who knows? It's all about, and you're gonna say this in a second. It's all about finding out triggers. So I guess all these things maybe have triggers.
Yeah, and I actually don't like the word triggers, but I saw it a lot.
Do you like the word the words red flag?
I do. I like a red flag.
Oh, okay. You like red flags.
Yeah,
you
red
don't like
flags.
trigger. You don't like when people say that triggered me.
Yeah, I don't. I don't at all. But what this thing does, it treats memories of a traumatic event, but not so much, Dave, like we're used to insights and thoughts. That's what they're pushing, right? It's treating memories, not so much insights and thoughts, but really memories to me are thoughts and insights. But I guess the idea being that it's less of a deep dive than, another form of therapy like a psychodynamic or a trauma focused CBT or something.
Can you go back to what you just said? Memories to you are thoughts and insights.
Yeah.
Are they though? Think about it. Memories can be somewhat detached from thoughts and insights in some way, in some aspects. I'm sure you could probably give me a laundry list of memories you have that involve thoughts or insights, but there's also just memories you have that just exist as memories.
So are you maybe we're talking about here like strictly the emotion from a memory.
Right. So
Is
if
that
you're
what's going on?
if you're thinking about, yeah, give an example of what you're talking about right now.
So I'm thinking of like any memory ever. So my first concert was New Kids on the Block, and I'm remembering that I was having a good old time just standing up there. Yeah, so I don't really know how that's. I have to think. I have to use thoughts and
Mm.
insights to kind of like conjure that. But then at the same time, I am remembering an emotion
Oh, so
that was happening.
you're talking about recalled memories
Mhm.
versus memories that just can kind of come up.
Right. And I think maybe with EMDR, the kind of memories that we're trying to work on here are repressed memories,
Or triggered memories.
triggered memories. Yes. You're triggering me by it. You're going to do that a lot, aren't you?
I am.
Okay. So why would people, I don't know, maybe you can answer this, maybe I can. Like, why would people decide to use EMDR over, other forms of trauma therapy? Like
Maybe other
psychohealing?
forms of trauma therapy weren't effective, Greg.
Yeah, you might be right. I guess you might be right.
Here's another one. It sounds super intrusive, but there is an aspect to it that's less intrusive because you don't have to just sit there and retell a story over and over and over the way you would in like other forms of therapy.
Yeah,
You're
like my
going into your,
office.
like what?
Like my office.
Yeah.
Right. I
you
want to
know
hear.
and actually the more like I have this one individual I work with, and she has a lot of trauma that she has not expressed to me yet because it is the idea of expressing it is just really too much for her at this moment. She's not there yet. I've been seeing her for a while. It's been like a year and a half. She still is not prepared because she knows when she brings up that trauma, she's going to have to leave that office. She's not just going to be a mess in that office. She's going to have to leave that office, and she's going to have to sit with that, all those things that she just brought up. And I think that's really important to like point out when we as therapists bring up trauma for someone and we discuss trauma, they don't just like end the session and say, "Oh, well, now I'll go on with my day." No,
Yeah.
they have to go out in the world and, with that trauma now back up at the surface.
So
So
so I
that's a
think
scary thing.
that is a scary thing. And with the EMDR, it does require you to get into that state
Yes.
of trauma and where you would be feeling that and like feeling like you want to leave. But what it doesn't do is require you to talk about it.
Right.
So
So
you
I mean,
can be in
you
that
definitely
state.
can still feel really intense feelings and
Right.
emotions, I'm sure. But it might feel a little bit more comfortable for some individuals knowing you're not going to have to give all these every single graphic detail.
So I think that it's starting to make me think that. So we're talking here that EMDR claims it focuses on the emotions and not the thoughts and the behaviors that result from an experience. But I don't see how that's done without challenging the thoughts a little bit.
So, and the other, another point to bring up. So, like you just said, it's working on the emotions and the feelings attached to the memory.
Mhm.
The memory doesn't go away. It just has less impact when it comes up.
Okay.
It now exists with less impact. I heard this person describing her experience with the MDR sessions. It was a really, really interesting way that she described the memory of how she knew when the memory was like processed, complete in the reprocessing portion. It felt like the memory went to black and white. And I thought that was like such an interesting way to
Mm.
describe it, because if you think about something vibrant with color, like there's emotion, there's feeling when you see something, but then she felt like it went to black and white, which to her signified it was complete, meaning it now is detached from the emotion and feeling that she had always attached to it. I thought that was a really interesting way to
That is
describe it.
interesting. And as you're saying that, I'm thinking with CBT, right? We're going to take a thought, we're going to change it, and that's going to change the emotion. Or we're going to take a behavior and we're going to change the behavior, and that's going to change the emotion. Maybe EMDR is taking an emotion, changing the emotion, and that's going to change the thoughts and the behaviors. Maybe it's just CBT, but you're starting with the emotion first instead of trying to change the emotion. You know what I mean?
Yeah.
I
Well,
think that.
and that's the interesting thing. You're right. It works in a different way because
Mm.
when you're with CBT, like you said, we're going to reframe the thought so that hopefully by reframing the thought and using it consistently, we will now feel different about that, whatever that situation is. But with this, yeah, you're working from the emotions, the feeling of it first, and then hopefully you'll experience the differently, and you just won't even have the thought. I don't know. There's something there, like with what you're saying. I don't know how to put it to words. So, but I think you're right. It works at it from a different angle. Like it's almost like they're coming from different angles.
Yeah, and I think that's cool. And I think it's useful the reality is here that yes, we might use EMDR. You and I both might use it. But I think coupled with psychodynamic, DBT, narrative exposure, like inner child, anything, right? It's never going to be just one thing. We're always going to try to attack an issue from as many angles as possible and try multiple things. But let's talk about the adaptive information processing. This is, I think, the most important ideas come with EMDR. So Francine Shapiro, though the woman who created EMDR, doctor, excuse me, I apologize. She recognized that
she didn't pay all those school bills just to be called her by her regular name. Come on.
She didn't cut and paste out of the theoretical theories textbooks to create a therapy.
Hey,
all right.
Francine, if you're listening, we would love to have you on the podcast.
Oh,
and I can ask Greg to not be on that episode if it would make you feel better. Thank you.
Or if she wants to do a podcast with you, I'm sure you would fire me tomorrow. I would be
absolutely.
Yeah. Just so you know.
All yes, right. Doctor.
But what she did do is she recognized that your brain stores normal and traumatic memories differently. Oh, really, Francine? Thank you. But during
Greg.
I'm kidding. Well, during normal memories, the process is smooth. Like me remembering my California Raisins trip or my New Kids on the Block concert, I that's a smooth memory. But during a traumatic event, that doesn't really happen that way. So there's this disconnect between your senses, for one thing, your analytic mind, which I'm saying that was actually left out of the description of EMDR. But I think that's the real issue that we've talked about a million times. But either way, if you have memories that you're not aware of, they become triggers, and you're in a state of panic because you're scared and you don't know why.
So Greg, another way to word all this, which is the way I found it on the EMDRA website, EMDRIA. They went through all the brain functioning, which I know you made fun of me last time for bringing that up, but it's the relationship of the amygdala to the hippocampus, which stores emotional memory to events, amygdala being like that thing that fires off the fight, flight, or freeze. And then the relationship to the prefrontal cortex, which, as we all know, does the rationalization and all that stuff. But basically that after the trauma, there's the hyperactive amygdala constantly keeping us in that state of hypervigilance, and the emotional memory being right there with the hippocampus. Just keeping everybody in, like, for whenever you experience that trigger, you go right back to that emotion of whatever that, experience was.
Absolutely. Now that science is taken care of, and we appreciate that, Dave. That was actually impressive, dude. I think you did that in one breath. But an example to understand how these memories are repressed, Dave, you learn in your life not to touch a stove, to bring it to your body, right? Because it'll hurt.
Some people do, yes.
Some people learn that. You don't touch a stove, it'll hurt. You just know that. So your brain kind of learns not to access memories that hurt you because it's going to put you in a state, right? So the idea is, did these memories that get you all worked up and make you not be able to go outside, or make you hypervigilant and cause all these issues in your life, the idea is to take the traumatic event that happened and reprocess it. And I guess what we're saying here is you're going to relive that traumatic event, but we're going to do it with all parts of our brain online. Like we're going to have all of our senses online. We're going to have our psychoanalytic part of our brain, the frontal lobe. We're going to have that online. And we're going to do that in a way, so that's the point of EMDR. We're going to reprocess the trauma by giving your brain another chance to process it by keeping your whole brain online. So that's why, like, we watch a scary movie, we go on a roller coaster, we have this traumatic event, but since like every part of our brain is online still, because we know we're not truly in danger, we process it fine and it's fine. So we just have to give our brain another chance at this. It's like giving our brain another stab at it. You know, you didn't do it right the first time, you didn't process it, so let's see what we can do. Let's try it again.
Or another way to look at it, it's not that it didn't do it right. It did it in the best way it knew how at that moment.
Mm-hmm.
Especially if you think about it for like younger individuals, a lot of like the coping skills that they learned is things that end up becoming like maladaptive coping skills as they get older, like dissociating in stressful moments. That's all they knew. So you can't. I think sometimes when adults like come in and they have these things, they're like, I wish I didn't do that. I don't know why I do that. It's like, well, that was the only thing you knew to do when you were at that age. So you can't get upset with yourself about something that you didn't know another way there was no other way to be safe. It's just the body's way of keeping safe.
We throw that word dissociating around a lot. Like, maybe we should kind of talk about that just a tiny bit, because to make people kind of realize what it could be like, is it doesn't have to be this traumatic event and you dissociate so heavily. But you ever driving?
I dissociate all the time, and I do it I actually do it in stressful situations too. I'm a big daydreamer, and I have learned about myself. I definitely daydream more when I am stressed, and I'm sure it's my brain and body's way of like avoiding thinking about something that's stressful or something that maybe is bothering me. I go into daydream mode quite often.
I hopefully not while you're driving.
Yeah, but I can daydream and
good. Yeah, drive. No, you're driving, and then that is a form of dissociation when you're driving, and then you get home and you're like, what? Like, you don't even remember it. Or like sometimes like I'm so used to getting on one highway, I'll get on the other one and I'll be like, where was I?
See, I've done that. I don't get to that state where I'm fully like can't remember. I can daydream and still be able to function pretty well.
Oh, are you
it's like basically for me, it's like just
right now?
It's like tuning out. No, because I've definitely have done and used to probably more often before used to do what you're describing. That's scary. I've had a lot of people recently bringing that up to me. I don't know why it's been such a common thing lately. And it's always comes back to the same thing. It's like
things are stressful right now.
Yeah, exactly. That's exactly what it comes back to.
It really does. And I think, and we'll get back to this, but I think someone had mentioned to me or described stress in a way that was very useful to me, and I want to share it with you right now. He said that stress is when the resources don't match the demands. And I think that's perfectly it. Like, when we don't have enough time to get everything done, we don't have enough money to pay our bills. Like, that's what stress is, when the resources don't match the demands. And simply put, that's what it is. So, Dave, how is this done? This is a multi-step process.
Oh, okay. Yeah, I'm up. All right. So there's 8 phases of this process. So the first one is pretty easy and self-explanatory. It's basically gathering patient history and information, trying to find out if EMDR is something that can help this person. And it may involve, getting some info about the disturbing events and memories that you'd like to focus on and what your goals are for the therapy. The next step 2, is preparation and education. So the provider that is going to be doing the EMDR session would let the patient know what to expect, and also possibly offer some strategies or tools to help with emotional regulation and talk about things to focus on to help feelings of safety during the sessions. Any questions so far, Greg?
Well, yeah. So they're using other forms of therapy as they're preparing to use EMDR.
Yeah, I'm assuming there's probably some DBT skills for emotion regulation, things like that. Yeah. Assessment. So that's stage 3. The provider will help identify themes and specific memories to work on during the reprocessing. That's obviously in collaboration with the patient. They're going to assist in helping to identify both negative beliefs about the trauma made and how it made you feel or how it impacted you, as well as positive beliefs you'd like to believe about yourself going forward. So it's not just about the negative things, and it's also about trying to like figure out. It's like CBT, I guess, reframing your thoughts, trying to turn it into something like, all right, so this happened. What positive things would you like instead of these things? Right.
Yeah. Like oftentimes, I just read this book, the Stephen King's book, I listened to it. I can't I feel like that's lying if you've listened.
You're a fraud. Is what
Yeah,
it
yeah.
is.
Hey, look,
Didn't tell us
I
that.
cleaned it up quick. I
You
cleaned it
did.
up
Good
quick,
job.
you know? So I listened to this book, Hearts in Atlantis. It's a Stephen King book, but I kind of loved it. And so there's this one thing that happens where just because you mentioned bringing something positive out of suffering, and I think sometimes people who have gone through something that made them suffer, those are the kind of people that like you could never be as good of a person without the suffering sometimes in the end, and maybe sometimes you could have never been as bad of a person, but like there was a very specific scenario where this person ended up doing something really good for somebody else, but it was because they remembered being hurt when they were young. You know what I mean? So this like suffering, it
Oh,
they ended up making meaning of it.
think about that though. Like you hear that all the time.
Absolutely.
You hear about people who like, all right, well, one of their parents maybe did something like left when they were younger or was, did some harm to, and they make it their mission to do the exact opposite as as they grow older in life. That's so important. I think that people will always go one or two ways. Either you're going to go the exact opposite of that person or that situation, and you're going to, use it as something meaningful and learn from it, or you're going to repeat it yourself.
Absolutely. And having felt pain and having felt, emotional pain as well, you can see it on somebody else a lot better, right? And you can empathize and you want that to change for them. And
Yeah.
I think that's why a lot of therapists have gone through a lot. And even in our own office, there's a lovely woman who I won't mention by name, but she had lost someone really close to her, like a child.
Mhm.
And now she's running like a grief group, and that's
Yes.
incredible. It's
Yes.
incredible, right? So like she had this horrible thing happen to her to the point where it's like, how do you even go forward with this? Well, maybe if you alleviate the suffering in others, that can help you, it gives you another purpose.
You make meaning out of whatever the situation is. You're exactly right. And that's all
Victor Frankl over here. I'm sitting across from him.
every single time you go through a situation. I personally believe the only way you truly move forward is when you can find a way to make meaning out of that.
Yeah.
Because otherwise you just sit in that despair of why did this happen to me? Or some sort of negative feelings like I deserved it, or I brought this on myself. Until you can find that ability to like, all right, well, this happened. So how am I going to go forward knowing that with the knowledge I've learned from this and from the experience and the strength that I have from surviving this, how am I going to go forward with making meaning out of it and maybe helping someone else
Yeah,
or just whatever, something positive out of it.
absolutely.
Good points there, Greg.
Thank you.
All right. So stage 4, desensitization and reprocessing is stage 4. So that's provider activates your memory by helping you identify one or more specific negative images, thoughts, and body sensations. Throughout the reprocessing, they guide you to help notice how you feel and any new thoughts or insight you might have about what you're experiencing. Part
Okay.
5 is installation. So the provider is going to help you focus on positive beliefs you want to build in as you process the memory. The belief can be what you stated in phase 3 or something new that you developed in stage 4. Um, Part 6 is the body scan part. So the provider is going to have you focus on how you feel in your body, especially any of the symptoms you feel when you think that about the experience or the experience of the negative memory. As you go through the session, your symptoms should decrease until you have none. So it helps identify progress throughout the DR therapy session. And overall symptoms, oh, no, I'm sorry. Once symptoms are gone, your reprocessing is complete.
Ah,
And then there's still 2 more.
okay.
Stage 7 is closure and stabilization. So the phase forms a bridge between later sessions. The provider is going to talk about what to expect in between sessions. And this is kind of what we were talking about earlier, because once these things are brought up, you also got to go home at some point.
Mhm.
And there's a period of time, obviously, in between sessions. So they're going to talk about what to expect, how to stabilize yourself if the negative thoughts, come up or between sessions. Also, like the session will not end until you have some sort of feeling of calm and safety. So if you were to bring up some really traumatic stuff and you're feeling really unstable, they're not going to just end and say, you got to go home. So as a therapist, you know that you have to be flexible. And that's something like, I didn't really think of, to be honest, when I was doing this research. I was like, wow, that's actually you would have to block that off.
Yeah, but that's happened to you, right? Where someone, maybe there's 10 minutes left and then now like everyone's crying and it's
all
like,
week last week.
yeah.
That's like, I feel like
Yeah.
that was every session last week.
Yeah. And you're like, how am I going to turn this ship around? Like, first of all, I don't want to run him back to in front of the front desk and everything like that. And everyone's like weeping. So it's like, yeah, like sometimes that's not, that means like some work was done. Something came out, that's important that needed to get out.
Or they just dropped a bomb on you within the last 5 minutes of the session. And you can't wrap it up. But you're right. It's like we do have to do that. But like this, I would imagine you might want to block off a longer amount of time because you can't really predict how the person's going to respond, I guess.
Yeah.
You hope that obviously they'll be able to leave when the session's time's over, but you might need to go a little longer. And then the last one is reevaluation and continuing care. So the final phase involves going over progress. This can help determine if additional sessions are needed or how to adjust goals and expectations for therapy. The discussion of what to expect in the future, as well as how you would like to handle things at that time with the new knowledge of self and past trauma. So those are the 8 steps.
Yeah. So what they don't really, and I've gone through the 8 steps too. And what I don't see there, and what's one of my critiques about EMDR is when you think of EMDR, you're thinking of the eye movement, right? You're thinking of the taps. So where does that come in? And I think
that's in the, are you asking?
Well, I mean, you could tell me if you want to.
Well, now you're making me not want to.
It's like step 4, I think. It's like step 4, right? But the thing is, it doesn't really
step 4 and 5,
right?
Because I also think during 5, when you're trying to get into the positive belief, I think that's also when you're doing that, because now you're taking that negative feeling and now you're installing the positive thing they want to believe about themselves, right?
Right. Also, it's this thing where, okay, so now we've gotten you to this point where you're in the trauma again. You're feeling it. You got the emotions going. Your sympathetic nervous system is going at full speed. So you're in a state of panic, or at least very emotional, highly elevated. Your state has changed. But before you dissociate, or before your body does that thing that it's going to do with that maladaptive response to the trauma, what the eye movement does, like the watch my finger, I'm going to move it back and forth, or where are you feeling this in your body, in your leg, I'm going to touch that there, or maybe just the tapping, just lateralization to keep both sides of the brain online. So what all that's doing, all the eye movement, all the tapping, all that is doing is it's an attempt to keep your frontal lobe, your senses, everything engaged so you can't dissociate, and you have to reprocess this. Because the first time you process this trauma, all those things went offline. You lost your ability to scream, you lost your senses, you lost your memory, you lost your ability to think. But this time when you go through the trauma, which you are going through the trauma, your brain doesn't know the difference. Yeah. You are going to keep all parts of your brain online. And when you do that, you're hopefully going to reprocess this trauma, but your brain's going to realize, oh, this is a safe thought now. This is a safe emotion now. I don't have to freak out anymore.
So back to that little science lesson I gave earlier.
Yeah.
What you're saying is when the experience was happening, the negative experience, mm-hmm. the amygdala fires off, which, like I said, it's the fight, flight, or freeze response of the brain. When that goes off, it's signifying we are in danger. So the rest of the brain goes into survival mode. So it's not all functioning normally.
Right.
So this is about activating that, but then keeping the rest of the brain open as well. So everything is absorbing the new experience, which is now a safer, less traumatic experience, right?
Yeah, it's like your brain fell off its bike and scraped its knee. And this time what you're going to do is I have this great spray. You spray off all that old dirt, get all that out of there. And now it's going to have a chance to heal. That's what we're talking about here. So Dave, I've done this without even knowing that I was doing this.
Okay.
So, with the hope of reprocessing a trauma, we all do that, right? We talk about it. We think it's important to kind of bring these emotions back up, give your brain a chance to experience it in a safe space. That way, it knows that you're not in danger anymore. But in order to do that, we kind of have to make them relive this traumatic event and feel safe at the same time. So I want the frontal lobe to stay along for the ride. So what I used to do, or what I still do, is I'll be having someone recount a trauma. But unfortunately, I will be having them like tell me the words, like telling me the story, right? But every once in a while in the story, and I'll warn them, of course, I'll ask them like an easy math problem. So they're like telling me the story, and I'm like, all right, what's 3 times 3? So they're telling me something that's very traumatic that happened to them, and now they have a math problem. So they're thinking of the trauma and thinking of the math problem at the same time. So they can't lose. For me, in my mind, I'm thinking, oh, okay, so the analytical part of the brain can't run away right now because it's being engaged.
So now you've just inserted trauma into their analytical part of the brain. So every time they do math, they're going to be triggered by the trauma.
No, that's not what we're hoping happens here.
No. I know that's not what you were hoping.
So, I mean, we laugh, but that's not what's happening, Dave. People love that. Well, they don't love the math problems. No one really loves that. That's a whole different kind of trauma. That's why I keep the problems easy. But here's the other thing. Here's another thing I'll do. Play sort of catch while we're just telling the story. Or, you know what I mean? Like just kind of throw a ball back and forth. So it's like you're doing, I don't know, in my mind, it feels like you're telling this horrific story, but now you're also doing something that's kind of needs your attention and you wouldn't be doing if you were in a traumatic event. So it's your brain's kind of like second guessing how dangerous the situation is. And you've seen I'm going to say it. You've seen my Chinese balls, right?
Yes.
Okay.
What
Well,
are those called? What's the actual name for those?
I think, well, look, Dave, obviously, if I'm calling them Chinese balls, that's what I think they're called.
Okay.
Well, there's got to be a name for them, right?
Yeah.
Like meditation balls?
I guess.
Sure. But, you know, have that thing with the hand and you're moving them along. And I think that's sort of a useful tool, too, for this. You know, I mean, it's shifting attention, I think, right? Because whatever you're focusing your attention on is going to drive
another thing that we would do during like exposure therapy is, you know, taking somebody's heart rate.
Okay. Sure.
And having them actively trying to, like, while they're telling or, you know, viewing something that they find traumatic or stressful, have them actively try to take steps to bring their heart rate back down. And that's probably part of this too, right? It's also trying to figure out, like, you're being analytical, like, all right, what will bring my heart rate down, right? You're problem solving. All right, I should probably take some deep breaths right now. So they're kind of utilizing their brain to
also they have like when they're able to bring their own heart rate down, you're like, oh my God, like I do have power over this. And that's relieving. So when I get to this state and my heart's beating out of my chest, like I have tools and I know that I can bring it back down. So that's another thing that's pretty important.
All right. So these are all similar to EMDR, but not exactly EMDR. I wanted to bring up something because I think it's worth saying. So in order to do EMDR, like obviously anyone could technically do EMDR. You shouldn't if you're not trained in it. But like, I mean, technically no one's stopping us from doing anything.
I'm doing the math problems thing, and you seem to think that that's a problem.
Well, there's also 1,000 people that think they're social media therapists on TikTok too. So, I mean, anybody can do anything, but it is not recommended to do this unless you have done a few basic steps. Well, I say basic, but everything is time consuming. So I guess it's not that basic. So to become an EMDR, to get EMDR trained, according to that MGA website, which offers a lot of trainings and things like that, minimum training requirements include 20 hours of instructional material, 20 hours of supervised practicum, and 10 hours of consultation. That's 50 hours for the training of EMDR. In order to get your EMDR certification, so you can say, I am certified in EMDR, there's steps beyond that. It also involves having frequent consultation and more practicum stuff. It's involved is basically the point, is what I want to get at.
It is involved. And I don't know. What do you think? Is this something that you're interested in? Are you going to add this to your toolbox or what?
Yeah. I mean, I thought you were too, no?
I'm going to, because honestly, I think that the more tools, the better.
Yeah. It feels so, like I said, like I have that one individual, and as I'm doing the research on this, I'm like, this sounds like exactly what that person needs, because I don't personally want to force this person to talk about stuff that they are not prepared to talk about.
So,
But I do feel like they would probably work through it with this.
and I think that's great. I do. I do. And I do understand that. And maybe, I don't know, isn't that on some level avoidance? And are you really reprocessing that trauma if like maybe this EMDR makes it easier to actually sort of talk it out? I don't know. My mind always goes back to, you've got this trauma, you've got these little fires all over your brain, and you got to turn around and look at them and expose them and put out these fires, I think, right? And does that require talking about it? Maybe not. Maybe it requires thinking about it and going through this process, and it becomes a very personal thing. And maybe you don't need to talk about it. I don't know. I'm kind of on the fence about it. I am interested, and I would want to, know more. Hopefully, all we're ever trying to do with these episodes is not say, hey, listen to this 45-minute episode on EMDR and now you're an expert. It's, hey, are you interested in EMDR now?
Yeah.
You know what I mean? Like that's all we're trying to do here. And I think I am.
You don't sound it. I'm not gonna lie. You do not sound it at all.
I'm not. Well, I'll tell you. I'm interested. I'm not sold on it. Is where I'm at.
I mean, all right. I can relate to that because I don't know enough about it. I haven't seen enough personally to say like, oh, this definitely worked. I mean, I'm a see it to believe it type of guy anyway, as you already know. So in order for me to truly know that it's effective, I would actually have to hands-on do EMDR to someone and then see the results.
Yeah. And I think
I want to.
It's worth exploring for sure.
Yeah. And Greg, can we just go back to the thing that I don't think we spent enough time talking about? You alluded to the tapping, the noises, the eye thing. Can you just describe what that looks like if you know? Because I want people to understand what you're even referring to.
Well, that's the thing that's one of my critiques about it. There's no real set guidelines to that. So it's about lateralization. So it's about keeping with the eyes. If you're moving your eyes from right to left, the idea is that you have to use both sides.
And how would you do that? How would you get someone to do that?
Just to have them look at your finger.
Or like a pen.
Or a pen, or they have like
we have a colleague that uses a pen.
Yep. Who?
I don't know if he wants me to throw.
Okay, that's a good point. So the light.
The only other dude that we work with.
Yeah. All right. Yeah, that's true. So yeah, there's that, and the tapping is kind of serving the same purpose.
But so are you doing the eye movement thing while tapping, or are you doing them one?
No, it's sort of one or the other.
All right. So you're having them watch this, or let's say it's a pen, having them watch the pen, and they're telling you the story. Or they're telling you something while you're having them, or they're thinking about something while you're watching the pen. Okay,
that's the thing too. It's very unclear how
maybe they don't want us to know all this stuff, because if they tell us all this stuff, we're all just going to do it. We're going to start waving pens in people's faces.
Yeah, I've got a pen. Trauma. I've got a pen. You know, I can do this tomorrow.
I don't need to pay those thousands of dollars.
Yeah.
I will be honest. It is not cheap to become certified in EMDR. That is probably one of the things that will prevent me from actually getting certified versus maybe doing the training. I'm going to be honest.
Right.
It's thousands.
Right.
And there is a pretty sweet retreat, though. That sounds awesome.
That would be fun.
Thousands.
What's difficult for me is, on one hand, it says you don't have to relive these repressed memories, but on the other hand, it's like, well, then what are you saying?
They're not saying that you don't have to relive them. They're just saying you don't necessarily have to talk them.
And then what are you saying? I'm in it right now. Yep, I'm experiencing.
Yeah, I'm there. Oh yeah. Nope. Yeah. Don't like that.
Okay.
Oh no. Oh,
so there's a lot of that. And then I was listening to this one lady, and she was saying, she ends up saying, just go with that a lot. Like, but I feel like that would be annoying if you're like, just go with that. It's such a therapist thing to say.
That's what I'm saying as the therapist.
As the therapist, yeah.
Just do it.
Just go with that. Yeah.
Let's go. I actually can't stand when people say that.
Follow the pen. Okay. All right. Well,
the pen will guide you.
Need a little more.
Greg, I got a couple of myths.
Oh,
myths and facts. Not too many. So one myth. This is from the Restorative Counseling Center of Chicago, I guess. So the myth is EMDR is just like hypnosis. I'm glad they had this because I actually had a conversation about hypnosis the other day, and I was thinking like, I wonder if EMDR is kind of like that because of the pen thing. It reminiscent of hypnosis. So the goals of EMDR are actually very different than hypnosis. It says during the entirety of EMDR, you are fully present and aware of what is going on, unlike hypnosis. And EMDR allows your brain to rework how a memory is stored in your body and brain and body. Hypnosis may focus more on creating psychological barriers to limit your brain's access to a traumatic memory. That's a pretty good explanation. I like that actually.
Well, dude, it's
So-
the complete opposite of hypnosis because
Yes.
the point of hypnosis is to sort of put you in a state of dissociation. And this is to try to make your brain stay online as much as possible. So it's like bringing as much awareness as possible to the moment. So yeah, the opposite.
Another myth is that EMDR can create false memories. I guess that's a conclusion some people might make. But the fact is that it helps you reprocess only what already exists in your memories. This treatment method is not intended to verify the accuracy of a memory. Oh, that's actually good to know too. Or the experience. Memories are already inaccurate and changed over time. Yeah. So it's completely dependent on your experience of a memory now. And the goal of EMDR is to help rework old information and find adaptive ways to gain a sense of safety in relation to your traumatic memories.
I like that. It's validating too. You know, because if your memory is, you know, maybe it doesn't jive with the way someone else who, you know, maybe you get this a lot where like someone's had a traumatic childhood and their mom is like, that's not how it was. You know what I mean? Or something like that. And you're like, well,
I have some people that question like, oh, I have this memory of this, but I don't even know if that's really real. So, and then they like devalidate themselves, right? Or they minimize even their own feelings about that memory because like, I don't even know if that happened. They say like things like that. It's a weird thing.
it is a weird thing.
I got one for you. So let's see if this answers maybe some of the questions we have. Myth. I will have to talk about every detail of my trauma. The fact. EMDR does not require you to talk about the extensive details of your trauma. You only need a few details about a memory to help you focus on it during the desensitization process. Your brain and body will do the rest of the work, since the goal of EMDR is to reduce the distress associated with your traumatic memories. The outcomes of EMDR are not determined by how much or how little you share. So you do have to say something about it.
So it's like exposure light, because anytime you're desensitizing yourself to something, you are kind of exposing yourself to it.
So here's the big thing.
Okay.
And it's taking like, all right, let's say somebody had a trauma that went like a complex trauma. And if you are familiar with our episode on complex trauma, that means it's a trauma that happened numerous times. You're re-exposed to trauma numerous times. Or like, you know, for someone who was like sexually assaulted over years or something like that, or number of times. You're basically going to take one memory of it and work there, right? You're not going to go into the details of all of it.
Nope.
You're going to start at one and you're going to explain a few things about the setting, like where you are, I'm assuming, and how it's feeling, maybe who's present. I don't know how far they'll go. And I think that's the difference. I'm not going to sit there and I'm not going to say every little thing about all of the traumatic experiences I went through. I'm not going to like even have to go into all the detail of everything that happened there, because in my mind, I'm in there and it's rehappening. Right. And I'm talking about how I felt. And here's the thing. We're talking about a trauma and we're talking about someone who has post-traumatic stress. So for them, like if we're just talking about a memory, all that stuff is pretty benign. Like we might remember a feeling, but it's faint. They're going back to these things, these experiences, and that stuff is all flooding out of them.
I'm starting to like it more.
It's different for them than it would be for you talking about the California raisin trip.
Right.
Okay. Because you don't have trauma connected to it. Right. So you can like think about it. But in order,
I could be thinking about my California raisins trip and say that was horrific. Say I got like, you know, it was the ice capades, and say I got slashed with an ice skate or something. I would be thinking about, be like, they could just want to know, like, well, how are you feeling right now? Like, you know, you're scared, or you know, so you don't have to.
So, and you know, what's different between that and like a trip that went totally fine. In order to really get into that trip the way that you experience it, you probably would have to state every single detail. You'd probably have to talk about it and explain it in significantly more language in order to get any emotion out of it or feeling, then when you're talking about a trauma, you can just say a few things, and I'm pretty sure you're right back there because that's that hippocampus campus like bringing you back to that emotion, right?
Right.
You're basically triggering yourself to go back into how that experience feels.
And maybe these memories are easier to access too because they're always there. They're always dictating your behavior. They're always making you feel on edge. So to access them, or to at least the access to feelings of them, especially if that's all you need to do, is much easier than trying to dig up the whole memory.
Yeah.
Because that's the feelings of the memory. You're not going to have all the actual. That's what's difficult when you're saying you have this memory, this trauma happened to you, and now your memory went offline, your senses went offline. So it's sort of impossible for you to remember exactly how it went. So it kind of relieves you of that.
Yes.
All you have to do is get there, get to wherever that there is for you, that feeling, that emotion, and be there. And let's be there safely and reprocess it.
And think about when you see someone who's been, triggered, like really triggered, like from like a traumatic experience coming back. Think about how quickly you can see it almost on their face when they're back there, wherever that was, it's different. So there are some things here that definitely seem to make sense, or at least be worth, I think, the continuing exploration that our field is giving it. So, and let's be honest, it's not going to hurt to have a new safe way to try to treat trauma, because not everything works for everyone. Everyone's a little different.
And this does work. It does. It's been studied quite a bit. It's only been around since 1989, but it works, and it works fast. There's less homework and it's less stressful. So, I mean, it's certainly worth a shot.
And if you're going to listen to people's critiques, just remember, people critique everything.
Mm-hmm.
So you can find a flaw, you can find a negative review, you can find people who dislike any theoretical model. There's people that dislike CBT, and I think I'm definitely very much a CBT therapist in many aspects, and Greg, I think you are too.
Absolutely.
Same with DBT, which we'll do an episode down the road. There's people that dislike that one. So it's just with everything. Take it with a grain of salt. Do your own research. If you feel like it's for you, talk to someone and gain more information.
I think there's no better way to leave it.
Yep.
And here we are, EMDR.
All right. Glad we got this out of the way.
Me too.
We've been talking about this one for a while.
Yeah.
It was a little like, yeah, but I know nothing about it. And also it's like the mushrooms episode, right? Are we going to get that critique? Oh, two guys who have never done it and aren't certified are describing it and basically still don't even know if they really know what it's about. We did our best. Take all of our information with a grain of salt, because as we said, we're not certified in it, but we have colleagues that work within it.
But that's enough. That we know that's a super unfair critique with the mushrooms one. Like, you haven't. That's like saying, like, I can't. If you're a cancer, oncologist, you've had to have had cancer to treat it.
Yeah.
I mean, that's not. That's not a fair assessment there. But whatever. I'm a little bitter about that one because that's our bad review. It's our only one. So whatever.
So yeah. All right. Well, hopefully this was somewhat interesting for any of you who have interest in theoretical models and different groundbreaking techniques that are coming out. So all right, Greg, what should we tell people?
Please leave a review. I mean, we won't ask to join the or if you want to get our subscribe to our what is that thing, Dave? Sign up for something.
So you could also offer some support by signing up on our subscriptions page, which is offered through Buzzsprout. If you look up Unconventional Therapists on Buzzsprout, you will see the link to the page. It's also one of the links in our Instagram bio. And speaking of social media, we would love to hear from you or have you follow us on social media. If you do follow us and you listen to the show, send us a message to let us know, hey, I listen. And
we love messages.
I'm not just a robot or some yoga practice or something like that. That's just adding a bunch of people that they think are kind of within their field. So yeah, we would love to hear from people. Yeah, that's it. So, all right, we'll be back next week. Everyone have a great week, and we'll see you then, I guess. Maybe. Who knows?
You never know.
I guess I'll be here, though, no matter what. How about you?
Yeah, I'll be here.
All right, at least we'll be here. If you're here, then...
We'll be here.
Okay. Hopefully you all will be too. See you then.